Hello, everyone. This is Dr. Kondrat, and welcome to the September 9th coaching call. I hope all of you have had a great summer, and today's discussion is going to be on chelation therapy. And there's been a lot of excitement about chelation therapy, renewed interest because of the recent publication of the TACT study. That's TACT, and that stands for Trial to Assess Chelation Therapy. Now, chelation is really not old, and this slide here talks about the new chelation miracle. It was discovered that when sailors painted the military ships, they were contaminated with lethal levels of lead. And the Navy discovered a therapy that quickly eliminated these deadly toxins from the bloodstream. Interestingly, it not only saved the lives of the sailors from the toxic lead, but they noticed there was a decrease incidence resolution of heart disease. And so this began the exploration of the use of chelation therapy in the treatment of cardiovascular disease. So the FDA does approve EDTA chelation for the treatment of heavy metals, but it is not an approved treatment for heart disease. So my early experience dates back to probably about 25 years ago when I was a busy ophthalmologist in Pittsburgh, Pennsylvania. My uncle, who's a dairy farmer, called me up and asked me, he said, Dr. Ed, what do you know about chelation therapy? And of course, in medical school, they didn't say anything really nice about chelation. It was quackery and it really didn't work. And I inquired, and my uncle had developed chest pain and was evaluated at the major university and was told that he needed open heart surgery and triple vascular disease. He had triple vascular disease, he needed a triple bypass. And that would probably cost him $100,000 because he didn't have any insurance. So he had heard from some of his neighbors about this therapy called chelation therapy. He wanted to give it a try. And I really couldn't give him much advice. I told him, well, give it a shot and see if it helps. So he did undergo a series of chelation treatments, 40, completely resolved his chest pain, and he was symptom-free, and he was able to work on his farm without any problems. So it wasn't until maybe about 5 years later that the chest pain came back, and he did not continue his maintenance chelation, because typically in chelation therapy, you need to do 30 to 40, and then every month you do a maintenance. So he stopped doing his maintenance, and at that time, he now had health insurance, and he went ahead and had his open heart surgery. So the open heart surgery was technically successful, but he did not have any change in his chest pain. He still had chest pain. And the doctors told him that all his vessels were open. There's no reason for his chest pain. It could be psychological. So he went back and had his chelation treatments, and all the chest pain went away. And so he was really upset. He felt that the cardiovascular surgery had no effect, and it was chelation that really helped him. More recently, my late father, who had Parkinson's disease and early Alzheimer's, had frequent chelation therapies, and I attribute the chelation therapies for keeping my father alive and helping him with his neurological function. There's no question that chelation helped him, and it was interesting. Every time he had a chelation treatment, my dad would say, you know what, my vision is just so much better after this chelation. Everything is so much sharper. So that's when I began to look at chelation therapy in the treatment of macular degeneration and eye disease. So this is the chelation molecule. It's EDTA, and it's a huge molecule, and it is composed of 4 vinegar molecules. We know what vinegar is, but this has 4 vinegar molecules, 1, 2, 3, 4, connected to a sodium-carbon chain. And this is an example of EDTA in action. It's a large molecule, and it binds or chelate. Chelation comes from a Greek word meaning claw. So it claws or binds a large metal, such as mercury, lead, or cadmium. Now, I wanted to talk a little bit about the EDTA chelation process, that when the EDTA is infused, and we'll talk about methods of infusion into the body, it does many things. We already mentioned that it removes heavy metals, in particular lead. It also removes abnormal calcium deposits. And then these either abnormal calcium deposits or abnormal lead, when it's chelated to the EDTA, is excreted in the urine. It's also excreted in the stool. But the interesting thing is that a lot of patients are concerned that EDTA chelation may accelerate osteoporosis. And especially in females, postmenopausal females, there's a concern about osteoporosis. But the studies have shown that when EDTA is administered, it removes the calcium, abnormal calcium deposits, not calcium in the bones. And the drop in serum calcium, that's the calcium level in blood, stimulates the parathyroid gland, and the parathyroid gland then stimulates the bone to develop more calcium. So it's interesting that chelation therapy can be helpful in osteoporosis, not harmful. So this is the TACT study, TACT, trial to assess chelation therapy. And this was a government study, National Institute of Health study, university-based, and it was a 10-year study over 130 clinics, 1,700 patients, a huge study, just to see, does chelation work? And this study specified 40 infusions of at least 3 hours each. And these 40 infusions were first 30 weekly infusions, and then they were followed by 10 maintenance infusions, 2 to 8 weeks apart. And this is kind of the standard cardiovascular protocol that has been developed by ACAM, acam.org. And if you're interested in finding a chelation doctor, that's the site to go to. So this was followed by 10 maintenance infusions, 2 to 8 weeks apart. And this is, let me back up, this is the chelation solution. And you can see that the main ingredient is 3 grams of sodium EDTA, ethylene diamine tetraacetic acid. That's that big molecule with 4 vinegar molecules connected. Also, it was given 7 grams of ascorbic acid, and magnesium chloride, protein, heparin, and various other B-complex ingredients, and sterile water to make up the mixture. And this was the mixture that they used. There's many other combinations of chelation solution that's used. One thing of concern when you do get chelation, especially the IV, is your kidney function. If you have compromised kidney function or decreased kidney function, it's recommended that you don't have the full dose of EDTA, and you have less. And this is the placebo, because in this study, it was randomized. If you were in this study, you did not know whether you were getting a placebo, or essentially water, or the active ingredient. And the placebo solution consisted of 500 milliliters of normal saline and 1.2% dextrose. So the results were phenomenal. In the group that had, now first of all, the people that were selected in this study were high-risk patients. These were people that were not healthy. These were people that had a cardiovascular event. Either they had a heart attack, they're having active chest pain, documented cardiovascular disease. So this was a high-risk group. This wasn't a healthy group. So the group that had chelation therapy, heart disease improved by 26%. By that, they talked about a cardiovascular event, either an episode of chest pain, a hospital admission, or something that merited medical care. Diabetic heart disease was phenomenal. That improved 39%. Heart attacks, 23%. This was unbelievable, these statistics. If there was a pharmaceutical drug that would come out that would show a 15% change, it would probably be the leading selling cardiovascular drug in the world. And so the results across the board were phenomenal. The other interesting thing about this study, people that entered the study were asked to continue their traditional cardiovascular treatment. So if they were receiving beta blockers, if they were receiving heparin or some type of cardiovascular medicine, they were instructed to continue that without making any changes. So if you want to learn more about this study, there's an excellent DVD called Unleaded. And those of you that are coming back to the Healing the Eye Wellness Center in Florida for a follow-up visit or for your 6-month visit, this DVD is available. But if you wanted to buy one on your own, you can go to the website www.unleadedmovie.com, or you can give our office a call at 800-430-9328 for more information on how to get this video. So what are the EDTA chelation benefits? Well, in addition to the essential foundation of healthy diet, exercise, sound sleep, and emotional health, and these are tenets that I always try to educate my patients. What if there was an easy way to rocket your vitality to a much higher level? What if you could reduce your chances of being diagnosed with cancer? And yes, there's a decreased incidence of cancer in folks that have chelation, heart disease, speed recovery from fibromyalgia, chronic fatigue, look and feel younger, and even increase your sexual capacity. Well, that is EDTA chelation. It's a time-tested, 50 years of safety and effectiveness, proven by medical research to help you. EDTA reduces cholesterol levels and helps to moderate blood pressure. It normalizes blood viscosity. Everybody is talking about keeping your blood thin. Many of you have been asked to take Coumadin or heparin to keep the blood thin because of a cardiovascular or a stroke. Well, EDTA helps to normalize your blood viscosity. It thins the blood to help prevent formation of blood clots, and it reduces the risk of stroke and heart attack, as clearly demonstrated by the TAC study. I myself have maybe a slight elevation of lead in my body, and I try to get at least 1 monthly IV chelation treatment and probably maybe an EDTA rectal suppository, and we'll talk about that a little later. If you're not too keen on getting IV, there's oral chelation products, and there's also rectal suppositories. It improves blood circulation, and this is one of the thoughts on how The TAC study showed benefits with cardiovascular disease. And of course, decrease in blood circulation is a major factor in conditions such as erectile dysfunction, intolerance of temperature extremes, chronic fatigue, intermittent claudication, and poor circulation. And I've seen so many patients who have had poor circulation in their legs, claudication, and after a series of chelation treatments, it has really brought back their life. Of particular interest, and this is how I feel that chelation can be helpful for eye disease, it improves circulation in the capillaries, which are the smallest blood vessels in the eye. And in particular, we're looking at improving that the circulation in the optic nerve and glaucoma and the retina and macular degeneration. One of the concerns that I often hear from patients who have macular degeneration, Dr. Condrat, I have wet macula. I don't want to improve my circulation because I'll get more bleeding. Well, that's false. We're improving the healthy circulation. And one of the reasons why you get bleeding in wet macular degeneration is because you have a decrease in circulation and the body is making new blood vessels, which are not as strong as your normal capillaries, and these have a tendency to bleed. EDTA also prevents free radical formation. It's a powerful antioxidant and destroys free radicals. And we know that these free radicals are everywhere in our body and that they cause damage. It's been shown to protect cell membranes, DNA, and enzyme systems. It has been shown to be a powerful antioxidant that destroys free radicals that are the culprits of arteriosclerosis, cardiovascular disease, Alzheimer's disease, and some types of cancer. And all these things are recognized as the cause of aging. So chelation therapy is a powerful way to help slow the aging process, improve circulation, and eliminate a lot of those toxic heavy metals. Also, it has been shown to increase nitric oxide. This helps to relax blood vessels, helps improve circulation, increases sexual potency, resistance to temperature extremes, and many other body functions. Nitric oxide is also beneficial for the health of the epithelial cells. And it keeps the inner walls of blood vessels healthy, and it reduces the need for plaque buildup. So now I want to talk on heavy metals. And I feel strongly that these are a contributing factor in all chronic eye disease. And those of you that have been through the Condrat program or the boot camp know that all of you will get a 6-hour urine challenge test. If you haven't had your 6-hour urine challenge test, please get it done. I can't believe many patients go through the boot camp. They take their urine test home, but they just never do it. Motivate yourself to do it. You are given a chelating substance prior to the 6-hour urine test. And the reason for this is if we would do a spot check on your urine or blood, chances are it's probably going to be normal because heavy metals don't stick around in your blood and urine. They go into your brain, fat, and bone. So we need that chelating substance to release the heavy metals, and you collect the urine over 6 hours. And this is an example of a toxic metal test, and this is not uncharacteristic. Typically, the lead is off the chart, and the reason for that is we grew up in a time when we had unleaded gasoline, or we had leaded gasoline, not unleaded, leaded gasoline, leaded paint, leaded pencils, and lead was very prominent in our environment. A shocking thing that I just learned, even though they call gasoline now unleaded, it still has trace amounts of lead, so we're not free from lead in the gasoline. I think over 80% of patients that I see have elevated lead, and not only is this lead a cause of eye disease, but I think it's linked to cardiovascular disease, and there's no question. Even Harvard studies have documented that increase in lead is related to cataracts. Now, the beautiful thing about EDTA, the heavier the metal, the larger the metal, the more attraction the EDTA molecule has. So it goes after mercury, aluminum, lead, arsenic, cadmium, and uranium. They're the big ones. It goes after these molecules. The smaller metals, such as zinc, magnesium, and calcium, selenium, it does not have as great an affinity. So it has a lot stronger attraction to these heavy metals, which makes it very, very effective. So let's talk about the types of chelation therapy. The number one that has been studied the most rigorously, and the number one they used in the tech study, is intravenous. Although many of you do not have access to a chelation doctor, or because of the expense, we are now looking at rectal EDTA along with oral. There's another method, a topical method, but that is only recommended in children who have mercury toxicity. So the three that we're utilizing in our practice is intravenous, rectal, and oral. I just interviewed Dr. Robert Rowan, who's the editor of Second Opinion magazine. And if you're interested in my interview, it's now posted on my website. And Dr. Rowan feels that because of the expense of intravenous, he's leaning more towards rectal suppositories and oral. Although, if you have extremely high levels of lead in your body, or you have advanced eye disease, end-stage glaucoma, or advanced macular degeneration, then I think it merits doing the intravenous compared to the rectal and topical, which is a much slower acting method. So here's the intravenous IV chelation, and I've been using a different modification, which I feel is a little bit gentler to the body, a larger amount of ascorbic acid and a smaller amount of EDTA in a shorter infusion time. And here's the alternative is detoxamine. It's a rectal suppository, and this is what I take myself. The rectal suppository is recommended you take it every other night, along with the ocular oral detox during the day, which is a mixture of not only EDTA and some other products. Well, that is the end of the webinar. And if any of you have any questions, please, you can type them. There is a comment here that the audio is terrible. If anybody else have horrible audio, please let me know. What I'm going to be doing is I'm going to be sending you a link to review this. This is being recorded. So my apologies if some of you have had poor audio, because from my end, the audio is coming through fine. A lot depends on your internet connection. So the way to ask me a question is on your control panel. You can either type in a question or you can raise your hand. There's a little hand button, and if you click the hand button, I'll know that your hand is up, and then I can unmute you and you can talk to me. So I'm here. If you have any questions about chelation, let's take the chelation questions first. If you have any other questions, feel free to ask me. And as always, I'm interested in future topics. So if there's a particular topic that you have an interest in or you want more information, email me and we'll schedule that for the next coaching webinar. These coaching webinars are held every month, the first Monday of every month. It so happened that the first Monday of September was Labor Day. That's why we had it the 9th. So any questions? Oh, the question is, what is the best organization for getting trained to do chelation therapy? I feel very strongly that the best organization is the American College of Advancement of Medicine, or ACAM, ACAM.org. They've been training chelation doctors for the longest period of time. All of my teachers have been trained at ACAM, and I have also been trained. It's a very, very thorough course. So those of you that are interested in finding a chelation doctor near you, please go to their website, ACAM, Apple Charlie Apple Mary.org, and you type in your zip code, and it'll tell you the chelation doctors near you. Well, if there's no other questions, I want to thank all of you for participating in the webinar, and all of you will be receiving a link and a copy of all the slides if you wanted to review this material. And as always, please give the office a call if you have any questions, 800-430-9328. And this is Dr. Kondrop thanking all of you for joining this webinar, and I look forward to continue to work with you to help you achieve good health and clear vision.